Imagine being stuck in a hospital room, waiting for days to get results or to be discharged. Not only is it annoying, it erodes trust between patient and care team. Our solution, Transparency and Treatment, emphasizes transparency during the hospital inpatient journey using Agentforce and Data Cloud. With Tableau Next, we also help the patient care team, such as unit managers, forecast their staffing needs by department. To build out the breadth of the solution, we primarily use Agentforce, Data Cloud, and Tableau Next APIs, Next.js, TypeScript, and Python as well. Let's dive in. In the patient portal, we're pulling data from Salesforce Data Cloud to populate the dashboard. Here we'll follow the perspective of a patient named Anthony Reed. He can see his personal info, care team, treatment progress, diagnosis, and department. Under treatment progress, he can see what was done during his stay, as well as what he can expect next. Under diagnosis, he can click on Explain My Diagnosis, and he will see an AI-generated summary powered by the Agentforce Models API. Next, the department status tells Anthony how busy his unit is, which impacts how quickly he may receive care. He's also able to get an AI-generated summary here to help understand what the status translates into for him. During Anthony's hospital stay, he has taken numerous scans and lab work, which is all confusing for him to understand. Here he can generate an AI explanation of what his test results mean, as well as draft a message to the corresponding team. Next, Anthony may also view his vital trends during his hospital stay, as well as any previous clinic readings. Again, all this data is populated from Salesforce Data Cloud. Lastly, Anthony can get more insight into his department by viewing a Tableau Next dashboard of the patient count by department, which gives him context into why things in a hospital seem to be moving so slowly. Last but not least, Anthony has access to an Agentforce-powered AI chat assistant that has all the info and context of any page Anthony views. In this scenario, Anthony is new to the hospital process and he wants to know what's next and what it all means. As you can see, the AI Health Assistant is capable of understanding and explaining the information on this page. For example, consulting team approval. Next, he wants to find out what the results mean for his ultrasound. We see that the AI chat assistant has context and details around his ultrasound. Under vitals, Anthony can ask, "Are my vitals okay for my age?" And again, the chat assistant will respond within context for Anthony. Lastly, the health assistant also has access to the info on this Tableau Next dashboard. As we can see, the chat assistant can tell which department is the busiest department in the hospital right now, highlighted as infectious disease. We can also ask it, how long will it take for me to get discharged? And this discharge date is also shown in the Tableau dashboard, as well as the context from previously. On the patient care team side, we have a Tableau Next dashboard that shows the patient flow for today. For this view, we'll follow the perspective of a unit manager named Bella who has limited access to patient medical records. She is tasked with coordinating environmental services to get discharged patient rooms cleaned up so that they can prepare for the next incoming set of patients. Bella gets a quick view of how many patients are to be discharged in every unit, and she arranges for those rooms to be taken care of. Next, she's forecasting how many nurses and nurse assistants her units will need in the upcoming weeks. She notices an indicator of a slowdown coming up, so she digs deeper into the departmental view to see where she needs to allocate staff. She takes note of the busier departments, such as cardiology and infectious disease. She also takes note of the readmission risk for these two departments, which may influence the number of incoming patients for the next few weeks. With Anthony's journey in the patient portal, he gets more visibility into his hospital stay and what might be delaying his discharge. With Bella's journey, we get a glimpse into how unit managers or other clinical personnel can use Tableau Next to help forecast staffing needs by department, without having to piece together information from multiple health management systems, saving them minutes, which adds up. Thank you for listening, everyone.